I'm rising today to once again join my colleagues. Senator from New Hampshire, Senator Shaheen, earlier spoke on health care reform and its effect on small business. I know my colleague, Senator Udall from Colorado, is going to be speaking soon, and I know we're going to be joined as well a little bit later by Senator Landrieu, who takes a leadership role on the issues affecting small business in her role as chair of the small business community. And I want to join my colleagues today again by stressing how important that health care reform is to the small business community. You know, small businesses across America right now have been very hard hit by the effects of the recession. Small businesses right now are struggling as they try to keep their doors open with the enormous constriction of credit that has taken place. Small businesses are struggling with being able to have the finances to expand, even healthy small businesses, as we've seen banks continue to draw back in capital and try to build up their own balance sheets. The people who've taken the hardest hit by the restriction on capital and the restriction on lending has been small businesses across this country. So you take the enormous challenges small businesses felt by the recession, that's been exacerbated by the constriction of lending, and then we add on top of that the enormous challenges that small businesses face in the healthcare market. The only people who pay retail, who pay full price for their health care benefits in America today are small businesses and those folks who purchase health care on the individual-based market. So there is no group that is going to be more benefited and that will have more to gain from meaningful health care reform if we do it right than small business. Small businesses currently lack the bargaining power of large firms and pay as much as 18% more for the same health insurance as larger companies. So if you work in a large company, you can get the benefit of the larger pool and your better ability to bargain for your health insurance rates. If you are someone who doesn't have access to health insurance and you're poor, you get access to Medicaid. If you're a senior, you get access through Medicare. Small businesses, again, are the group that fall within the crack, don't have any of this access to this purchasing power, and consequently pay on average about 18% more for health insurance than larger companies. Unfortunately, as health insurance continues to rise, more and more small businesses can no longer even afford to offer health insurance to their employees. And if they do, their employees can't afford to do the co-payments and purchase health insurance. Matter of fact, nearly 1/4 of the uninsured in our country work for small businesses. Between 2000 and 2009, the percentage of firms with less than 10 employees, so the real heart of small businesses, less than 10 employees offering insurance coverage fell from 57% to 46%. Among people with employer-based coverage in January of 2006, one-sixth of the people who had employer-based coverage had lost their coverage by 2008. And nearly 3/4 of small businesses who do not offer coverage to their employees cite high premiums as the reason. Small businesses would like to offer this type of benefit to their employees, but because they're priced out of the market, they're unable to offer that. Many small business employees are left uninsured and in turn rely on the healthcare system to pick up the costs when they get sick. It is people that show up at the emergency room door accessing the most inefficient part of our healthcare system, the emergency rooms. They are oftentimes not folks who don't have work, but they are folks who work for small businesses. So enacting market reforms, such as creating insurance exchanges, will give small businesses, finally, affordable options. Their employees will have a place to purchase insurance at